Thank you so much. And thank you to the panel and to the audience for joining us today at this August meeting of the Scientific Guidance Panel for Biomonitoring California, a program more formally known as California Environmental Contaminant Biomonitoring Program. Yep. Is this better? Okay, so I have a few remarks. I'll start off by introducing myself since I am new-ish to OEHHA, and then we'll recap some of the major discussion points from the March meeting. And then we'll move into introducing the panel member and including introducing a new member. And then I'll pass it off to Lara Cushing, who has graciously agreed to be our acting chair for this meeting. So my name is Kris Thayer. I started at OEHHA in middle of May of this year. Before that, I worked at the U.S. Environmental Protection Agency in the Office of Research and Development. I headed a program called the Chemical and Pollutant Assessment Division. This was a program that did, if you've heard about Integrated Risk Information System or IRIS assessments, provisional peer review toxicity values. So we did chemical assessments. I was there for 8 years. And then prior to that, I was 13 years at NIHS working in a program that was then called the Division of the National Toxicology Program. I used to head up their assessment groups, but I've always had an interest in biomonitoring. So when there were opportunities, I engaged in that area, including doing some biomonitoring work to explore exposure to cashiers, to BPA and BPS and related compounds and receipt paper. At the time, there was a lot of interest in organotins as an endocrine disruptor that from animal studies looked like it had a pretty potent adipogenic effect. And we were interested in exploring the extent of exposure in pregnant women. So there was some methods development and then some biomonitoring on organotins. And then I also kind of worked on trying to partner existing academic cohort studies, the samples collected, with the analytical capability of CDC to see we can get more out of those samples, to look at things like diabetes, focusing really on sort of childhood exposures. So it's great to be back in a program that has an explicit biomonitoring program. So it's great to be here. In terms of the last panel meeting, it was March 25th, 2025. The summary and the transcripts are on our website at biomonitoring.ca.gov. Some of the high points, and so there were updates from the biomonitoring program. There were also presentations on per and polyfluorinated alkyl substances, or PFAS, in drinking water. So some of the key discussion topics. There was a presentation about Biomonitoring California analysis of the CARE, California Regional Exposure Study, in the context of looking at differences in metals that were measured in urine and blood in participants who were living near wildfire affected areas. There was also the topic of looking at data from STEPS, studying trends in exposure in prenatal samples, again, in the context of populations that might have been near these wildfire impacted areas. There was discussion about the importance of evaluating biomonitoring programs the results reports that were delivered to populations that had participated in the studies, especially in the context of thinking about the messaging with a culturally and language diverse audience. The panel also discussed the analytical findings of PFAS in drinking water. Some of the topics included suggestions for additional analyses of legacy PFAS in diet and water in California, how to account for the impact of socioeconomic status when looking at PFAS levels, California activities compared to other states and federal activities with respect to regulating PFAS. And then also the widespread presence of ultra short chain PFAS, such as trifluoroacetic acid, that have been detected in wells from the water board. So again, the summary and transcript of that meeting is posted on the March meeting on biomonitoring.ca.gov. So now, again, I want to thank Lara Cushing, who will be acting as our chair today. And then before inviting other panel members to introduce themselves, I'd like to announce Thayer Durrani, who was appointed in June to be a new member of the SGP by the Speaker of the Assembly. So Dr. Thayer Durrani is Professor of Clinical Medicine at University of California in San Francisco, serving as Associate Chief of Occupational and Environmental and Climate Medicine, board certified in family medicine, preventive medicine, occupational medicine, and medical toxicology. Thayer's clinical practice includes providing outpatient consulting for medical toxicology and caring for acutely poisoned patients. He is director of the Western States Pediatric Environmental Health Specialty Unit and is faculty of record for occupational toxicology at UCSF. Teaches medical, nursing, and pharmacy students, as well as a variety of graduate students. Volunteered his medical expertise internationally and has served in the U.S. Army in Afghanistan. So now I will administer the oath of office and ask you to raise your right hand and repeat after me. I, Thayer Durrani, do solemnly swear
I, Thayer Durrani, do solemnly swear
that I will support and defend the Constitution of the United States
that I will support and defend the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
that I will bear true faith and allegiance
that I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation or purpose of evasion,
without any mental reservation or purpose of evasion,
and that I will well and faithfully discharge
and that I will well and faithfully discharge
the duties upon which I am about to enter.
the duties upon which I am about to enter.
Thank you. Congratulations and welcome to the panel. We're delighted to have you. Okay, I will now invite the panel members to introduce themselves. We'll start with panel member Oliver Fien, UC Davis, who is attending remotely. Although I guess I've actually already introduced Oliver.
Yes, so I'm Oliver Fien. I'm an analytical chemist and toxicologist for many, many years, and I am at UC Davis.
Thank you. And then we'll start at the table, starting with Tom.
Hi, I'm Tom McCone. I'm a professor emeritus of environmental health sciences at the University of California, Berkeley School of Public Health. I'm also a retired affiliate with the Lawrence Berkeley National Laboratory.
So Rika.
Hello, I'm Ulrika Luderer. I'm a professor in the Department of Environmental and Occupational Health at UC Irvine and director of the Center for Occupational and Environmental Health. I'm an occupational medicine physician, and also my research is in the area mainly of reproductive toxicology.
Hi, everybody. I'm Penelope Quintana, nicknamed Jenny, and I'm a professor of environmental health at the School of Public Health at San Diego State University.
Good morning, Lara Cushing, Associate Professor of Environmental Health Sciences at the University of California, Los Angeles.
I'm Thayer. You go. Just met me. Nice to meet you.
I'm Amy Padula, Associate Professor of Obstetrics, Gynecology, and Reproductive Sciences at the University of California, San Francisco.
Thank you. Thank you again and welcome. Okay, with that, I'll turn it over to Lara.
Thank you, Kris. So I'll be acting as chair for this meeting and wanted to start by reminding panel members to please comply as usual with Bagley-Keene open meeting requirements. All discussions and deliberations of the panel about the subject matters at issue today need to be conducted during the meeting, not on breaks, or with individual members of the panel on or offline, including via phone, email, chats, or text message. How's my volume? Is it too much? Okay, all right. Panel members who are attending remotely must physically appear on camera during the open portion of the meeting. If you're unable to keep your camera on during the meeting because it's technically impractical, please make an announcement when you turn your camera off. Additionally, if someone older than 18 is in the room with panelists who are attending remotely, you must disclose the presence of that person and their general relationship to you. Okay, so we'll begin with an update on program activities, including results from the BiomSPHERE study. And then in the afternoon, we will have presentations from two guests on silicone wristbands as an exposure assessment tool. And we will have a fair amount of time for discussion on the use of silicone wristbands as a way to complement biomonitoring studies. There will be time for questions from the panel and audience after each presentation. If SGP panel members wish to speak or ask a question, please raise your hand. I'll call on you at the appropriate time, and then you can ask your question or provide your comment. If online webinar attendees have questions or comments during the question periods after each talk, you can submit them via the Q&A feature of the Zoom webinar or by email to biomonitoring@oehha.ca.gov. We will not use the chat function during this meeting, so put your questions in the Q&A. Please keep your comments brief and focus on the items under discussion. Relevant comments will be read aloud and paraphrased when necessary. Oliver and other online attendees, if you wish to speak during the public comment periods and discussion sessions, please use the raise hand feature in Zoom, and Rebecca will call on you at the appropriate time. If you are attending in person and wish to comment during the public comment periods and discussion sessions, please come to the front to raise your hand and I'll call on you at the appropriate time. For the benefit of the transcriber, please clearly identify yourself before providing comment and write your name and affiliation on the sign-in sheet at the back of the room. At the end of the meeting, there will be time for an open public comment period. So with that, I'd like to first introduce Nerissa Wu, who leads the exposure assessment section in the Environmental Health Investigations branch at the California Department of Public Health, and is the overall lead for Biomonitoring California. Nerissa will provide an update on current program activities.
Thank you, Lara, and welcome to all of our panelists. Special welcome to our new attendees and panelists. It's great to have your expertise added to our group. I will be giving a program update, and I believe there's a little bit of a lag here. How long is the lag? Should I keep clicking? Thanks. I'm going to be touching on different components of the program, including our surveillance and community-focused studies, the laboratory work that's been done in this period, and outreach and communication activities. So let me talk about where we are with various surveillance studies, including CARE, STEPS, measuring analytes and material archive samples, MAMAs, and just a few words about our future surveillance plans. So we have presented in recent meetings on CARE, particularly PFAS and drinking water and food, as we heard from our summary. Emily Penoyer, who just presented at our last meeting on these associations, has just published her manuscript in Environmental Science and Technology. And Toki Filman, who also presented her work on CARE participants and drinking water associations, has just had her manuscript accepted at the Exposure Science and Environmental Epi Journal. So that will be coming out in the next few weeks. And we're very excited about that. Green. Oh, there we go. We now also have additional data for speciated arsenic and phenols for CARE LA. So initially in 2018, only a subset of samples collected were analyzed for speciated arsenic and phenols, but the Environmental Health Lab has provided us with results for the remaining samples. So we have gotten the results returned to participants. You can see our staff packing up those packets right there. We've weighted the data to the underlying population, and that data should be up on the web in the next week or so. And we are diving into the data. So why are we doing this? Well, arsenic is a chemical of concern, of course, and in both CARE LA and CARE Region 2, the numbers for total arsenic were found to be higher than the national numbers. We know that organic and inorganic arsenic are generally coming from different exposure sources, with organic arsenic primarily coming from seafood and inorganic arsenic coming from contaminated groundwater, industrial processes, pesticides, rice, and other sources. And inorganic arsenic is more of a concern with regard to health impacts. Through our program's protocol, we have historically identified participants for individual follow-up who have a total arsenic level that hits a certain threshold, these levels of concern threshold. We then speciate the arsenic for those participants only so that we can compare their inorganic levels to our level of concern, and then work with the participants who meet that threshold to identify exposure sources and recommend ways to reduce exposure. So for that subgroup of people with the elevated arsenic levels, we have a lot of data on their inorganic levels and also the ratio between inorganic and organic arsenic, but it's not data that we can extrapolate to the general population because it's an unusual group. So we really wanted population level data to help us understand what the impacts of arsenic exposure are on the general population and to help us identify if there are populations that are disproportionately impacted. We also hope that this data will be helpful information for the water boards as they investigate technological and economic feasibility of lowering the MCLs. So as part of CARE-LA, we measured urinary metals in 428 participants, including total arsenic. Of those, 106 met the threshold to have their arsenic speciated, and those results went back to participants in 2019. So round two, we looked at the remaining 322 samples, excluding 14 participants who did not consent to have additional analyses run. So that gives us 414 participants, and only 412 are included up here because 2 of those didn't have a detectable creatinine. So their creatinine adjusted data couldn't be included. Of the many arsenic species, our method quantifies 6. So arsenic 3 and arsenic 5, MMA, DMA, arsenobutane, and arsenocholine. And it's those first 4 species that are summed as the inorganic related species. I just want to point out that MMA and dimethyl and DMA are summed with the inorganic related species because we conservatively assume that they're biomarkers of exposure to inorganic arsenic. So this table presents the weighted detection frequencies and geometric means, both for individual species and the sums. And then we compared these statistics to the national numbers from the 17-18 NHANES cycle. And just a couple things to note on this table, our lab's limits of detection, our LODs, are lower than the NHANES LODs. So first of all, kudos to the lab. It's really great to be able to have that low LOD. So we have really a nice complete data set to look at the population. We've censored the data based on the NHANES LOD so we can compare between the populations. And you can see that Los Angeles had higher detection frequencies for all of the species and the sums of those species compared to the national numbers. We've also compared the geometric means, and both for the sum of inorganic related species and for DMA individually, Los Angeles had statistically higher geometric means compared with those national numbers. There have been studies in the past, both in California and the US, that have shown a sociodemographic and geographic inequity in drinking water arsenic concentrations and MCL violations. So we'll be looking at demographic patterns in our data. We'll also be using our questionnaire data to look at potential exposure sources. And just a reminder, in our questionnaire to care participants, we asked about diet, drinking water source, occupation, hobbies, smoking habits, etc. We're always interested in identifying opportunities for health education or intervention to reduce exposures. And we're also really interested in identifying partners, invested parties who might want to work with us on both the work we're doing and also messaging it out. So we look forward to hearing input from this group with respect to recommended next steps for analyses, but also partners we might reach out to. Also, we will be getting data from CARE2 speciated arsenic later this year, so we'll have more power for these analyses. For phenols, briefly, we've been measuring phenols in Biomonitoring California studies since 2010, and our method does include bisphenol A and 2 of the analogs, which are used as substitutes, benzophenone 3 or 4 parabens, which are used as preservatives, and triclosan and triclocarbon, which historically have been used in antibacterial soaps. And these are all of a concern because of their endocrine disrupting properties. So in CARE-LA, we had 428, again, starting with that, but we were only able to measure phenols in 60 participants initially. And we wanted to analyze all the samples again so that we could have population data. And we were able to analyze 346 additional samples for a total of 406. So this table presents weighted detection frequencies and geometric means for CARE-LA. 4 analytes had detection frequencies over 75%. So benzophenone 3, BPA, BPS, and methylparaben were all in a majority of participants. Both of the antibacterial agents, triclocarbon and triclosan, had very low detection frequencies, 38 and 16%. Maybe not surprising, both were banned from soaps in 2016, and these are samples collected in 2018. We could not finalize data for butylparaben in round 2, and so we did not have enough results, and it wasn't representative sampling. So we dropped butyl, unfortunately, from this weighted sample. The LODs, the limits of detection, were different between EHL and NHANES. So, and some were higher for our lab, some were higher for NHANES. So we censored the data to whichever LOD was higher so that we can compare between these populations. And detection frequencies were generally lower in Los Angeles compared to national numbers, with the exceptions of benzophenone 3, that one exception. In a comparison of geometric means between Los Angeles and national numbers, benzophenone 3 was significantly higher in Los Angeles, as was bisphenol S, and methylparaben and BPA were significantly lower. So, still thinking about what the significance and what source might be of these differences, we did see elevated BP3 levels in the Fox study, and this is a UV stabilizer used as an ingredient in sunscreens. And at the time, we hypothesized that this was due to, it was in a sunny California climate, people were wearing more sunscreen. As far as BPA goes, BPA was added to Prop 65 in 2015. So maybe there's a difference in product formulation or utilization by state, something we'll continue to watch. And we'll continue exploring the data. We'll be looking at distributions in the population, which we hope will be helpful to groups like the Safer Consumer Products Program as they consider alternatives for parabens. There's also Senate Bill 1226, which will ban bisphenols in juvenile products like teething rings starting in 2026. So we're always thinking about how our data might be used to look at what impact those legislation have. We do have exposure questionnaires, but unfortunately, the part of the questionnaire that focused on very recent exposures did not center around phenols until CARE 2, but we are hoping to have CARE 2 phenols data in the next year, and then we will be able to explore those exposure sources further. So moving on from CARE, we also have the STEP study, which will look at PFAS levels among pregnant Californians over time in 3 counties. The lab has conducted analysis in all of the Orange County samples from 2015 to 2021. They're now completing QA on all that data, and we hope to have that later this year. They're also making a lot of progress. More than half of the Fresno samples have been run, and we are waiting for the 2024 birth records for Los Angeles County so that we can select the samples from LA County that fit our eligibility criteria. And STEPS was built on the success of the MAMA study, which demonstrated the utility of biobank samples. And MAMA's data analysis, which you heard a little bit about last summer, was just presented in 2 different presentations at the ISEE conference. As part of the poster, Trends of PFAS and Persistent Organic Pollutants in Pregnant Californians by Dina Braca, and Persistent Organic Pollutant Levels in Californians, shouldn't hexachlorobenzene be decreasing? And that was presented by Ian Tang. There is still a lot of analysis to be done with CARE, MAMAs, and STEPS data, but we're also in the early stages of designing our next surveillance efforts, which we hope will involve field collection of samples. So of course, the big goal is to develop a methodology that can be sustained into the future to generate the kind of reliable, generalizable data that we can use to look at trends. But there are always choices to make since we can't cover everything we would like to. So we're thinking about what analytes to prioritize. Are there particular subpopulations to prioritize? Where in California should we be focused? Because we just can't get to the entire state all at once. And while we ponder these questions, we're also thinking about ways to make our lab methods and our field work more efficient. So one of the things we're doing is evaluating these microsampling devices, which would be less expensive and less invasive and give us much more flexibility in the field. And they basically clip onto your arm. You can see a picture here of it clipped on, and it collects 400 to 500 microliters of blood. You can also use serum separator tubes and spin that down for a serum sample. You can see how happy I am to have collected 500 microliters of my blood here. So that's something we're really looking at because it would really change our field work. So I just want to shift a little bit to now provide some updates on 4 of our community-focused studies, and I am starting to go faster because I know my time's running out. So our work has largely been focused on getting results and program findings out. In BiomSPHERE, the team has completed returning biomonitoring results, most recently for urinary metabolites of PAHs and VOCs. You'll be hearing about that from Aalekhya in just a minute. We also have an evaluation of results return materials for BiomSPHERE, which you heard a little bit about last November, and that's ongoing, including assessing participant experiences with Silent Spring's electronic results return platform. So that's a really exciting development for the program. For Fresca, the team has also completed returning biomonitoring results, which included metabolites of PAHs, VOCs, and metals. And the team also just held a community meeting in July, which was very well attended. For the Asian Pacific Islander Community Exposures, or ACE project, you heard recently about the associations between seafood consumption and serum PFAS levels. Kelly Chen has submitted her manuscript for publication. It's in review, and we expect to have that out in press in the fall as well. For SAPEP, we have submitted a short communication to a journal for review, highlighting the PAH and VOC findings, particularly the high levels of naphthalene that were measured in SAPEP. And as we release these publications, we're also thinking about how to disseminate findings to a wider audience. So there's a lot of social media, fact sheets, lay audience friendly ways of getting information out that are also in production. So quickly on the lab side, I've already mentioned the progress that the labs are making analyzing samples collected for various studies. This is just a summary of the progress ECL has made on STEPS. We're also continuing to explore different PFASs. We're about to send aliquots off as part of our pilot study to have ultra short PFASs measured, and everyone is very curious to see how that's going to go. The lab's also about to demonstrate their new serum methods, cyclosiloxanes and PAHs, which will help us understand impacts of personal care products, wildfires, and other exposure sources. Over in the environmental health lab, staff continue to provide data on the CARE study. We've talked about arsenic and phenols data that have been reported. They've now moved on to CARE 2, and we'll have that data out in the next year. They are also working on non-targeted screening to improve targeted methods and potentially identify additional chemicals of concern. So for example, they're working to identify new biomarkers of PAH exposure, particularly for naphthalene and phenanthrene. And they're exploring the use of AI in non-targeted screening to enhance staff efforts to identify chemicals. We've talked about non-targeted screening here before. It has this huge potential to help expand our universe of chemicals that we can identify and quantify, but it's super data intensive. So making this process more efficient would be extremely helpful. And as I alluded to, with all the findings coming out of the program, our communications team is working on different ways to broadcast the message. We've been developing fact sheets that are devoted to summarize scientific publications. Staff are working on social media campaigns, and this is not the updated slide because we actually just got social media out on PFASs yesterday, which is very exciting. And we have some short videos in production that will also be posted online. Can't get any of it done without this extraordinary team, so thank you to all of you, and I will now pause for questions.
Thanks, Nerissa, for that great update. So we'll now invite short clarifying questions to start, either from panel members or the audience. Please hold the more substantive questions for the open discussion period that we'll have shortly. But are there any questions, clarifying questions at this point? Yeah, Tom.
Yes, on the slides on arsenic comparing CARE, I guess, or yeah, the CARE study to NHANES. I think you mentioned a little later there was one where, next one.
Was it detection frequency or geometric mean?
The ones where with the arrow showing that two are there. So those are significantly higher, right? Inorganic species in CARE. I think you mentioned it, but is there some operating ideas about why it's higher in CARE LA?
I am going to call on Toki Philman, who is the analyst doing this work. I don't know if you have an answer.
And if this is a lengthy discussion, we can hold it.
Thank you for this question. So I don't think we have we don't know the exact reasons why, but of course it could be due to some of the major exposure sources for inorganic arsenic, which include diets such as rice consumption or drinking water. As we know, in California, we have a higher proportion of the population who are Asian or Hispanic, which are known to eat more rice. And also in terms of drinking water, there have been some recent studies that have shown that public water system drinking water in the Southwest states, which include California, also Arizona and Nevada, can have higher drinking water arsenic concentrations as well. So it may be due to these exposure sources, but we do look forward to exploring this data further to get some better ideas about this.
Hi, Jenny Quintana. Just a clarifying question on the next slide, I think. So you're talking about arsenic, this little blue box on the right-hand side at the bottom,
Yes.
about other things you're exploring, and you mentioned smoking at the end. I'm just curious if your questions also ask about secondhand smoke, because tobacco smoke is a source of arsenic and other metals.
I don't remember. Do you guys remember? It does.
Okay, great, thank you.
None of these are questions for me, I guess, but yes, we asked about secondhand smoke.
Rebecca, have there been any questions on the Zoom Q&A? Where is Rebecca?
We have not received any questions from online.
Okay, so why don't we go ahead and move into the open discussion period for more substantive questions and comments. We have 15 minutes for this.
I have a question, which is maybe getting into a bit of a different topic, but I mean, obviously, many of the chemicals that you've talked about today have to do with, are in plastics, found in plastics. And there's also, I think, recently just been a lot of awareness of microplastics and nanoplastics. And I was wondering if that is something that you are thinking about as a program. It's a little bit off on a tangent, but I'm curious.
It is definitely a topic that gets raised to us all the time. Maybe you remember in 2023, we did a round of program evaluation interviews, and microplastics came up from most of the interviewees. We're actually starting a new round of that, and I expect microplastics to come up again. It's obviously super important. The methods, we're following the methods. If Jeff Wagner's online, maybe he could speak to this a little bit, but there are a number of different methods that are being used in fish tissue, and human. There have been a number of papers coming out on human tissue, but I don't know that we have a method that we could use on a large scale yet for biomonitoring. But yeah, it's obviously something super important for us to keep in mind. Most of the stuff, and we have a lot of plasticizer type chemicals, and we'll continue to measure those.
This is Stephanie Jarmal. Just a quick reminder to please identify yourself when you're providing public comment.
Oh, and Jeff is actually online if he wants to weigh in.
Yes, Jeff, please unmute.
Yeah, thank you. This is Jeff Wagner. Yeah, following up on Nerissa's comments, I agree. Some of the analytical issues with microplastics include you've got a number of polymers at minimum. Say most studies look at maybe 6 different polymers up to maybe 20 different polymers. And then, like Nerissa mentioned, there's all the plasticizers and flame retardants that are associated with them. So you've actually, and then if you throw in particle size, which is, I think, a very key aspect of even defining what your analyte is, whether you're talking about 5 millimeters, 5 micrometers, or 5 nanometers, you've got a pretty complex matrix of analytes. And then you add to that what the target organs are and what you would expect them to be, and whether or not they would show up in traditional matrices like blood or urine. So yeah, it's complicated.
Hi, this is Kris Thayer, and also microplastics are on OEHHA's radar, so we're monitoring the exposure space as well as thinking about sort of health outcome comparison. I do have a quick question. When you were talking about the micro samplers, which are very exciting, do you have like a range of how many chemicals that use sort of a blood-based matrix you might be able to get from a micro sample?
Well, the limit is probably, I mean, we can get whole blood or serum. So anything that we're looking for in a traditional blood or serum sample, we could look at. The limiting factor will be our volume, because with a 400 microliter sample, about 200 is of serum So we might be only able to run one panel on that. Right now, our focus has been PFAS in our most recent studies, but especially with the hexachlorobenzene work that Ian's been doing, I mean, the thought of not measuring our legacy pollutants to track trends in there, that's a loss as well. So this is the kind of, there are all these considerations we need to look at as we plan our study. And I'll say that the microsamplers appeal to us. The logistics of getting into the field and handling so many participants and gathering their samples, it's just very difficult logistically. So something where we could use a microsampler without phlebotomy really opens up a lot of possibilities for us. And can I say one more thing about microplastics? We also have to keep in mind our designated list, what we are enabled to measure in a biomonitoring study.
I also just wanted to follow up on these microsamplers. I was also wondering which study populations you're employing them in, and then also if you're looking for additional study populations where that could be expanded, and also if you have a sense of the cost yet per sampler. I mean, of course, the analysis is a whole nother story, but.
Well, we are not using them in a study just yet. Our lab is actually looking at them and screening them for PFAS and metals. There is a metal blade that kind of sticks into the arm. And so we have to make sure that it's not contaminating our samples before we use them for anything. We'll then use them as part of our pilot study so we can do venal puncture versus microsamplers and see if there are differences. And we're also assessing the usability. How long does it take? Are they acceptable by participants, et cetera? So it's a little ways down the road. We're eyeing them for our surveillance in the future. Again, the big payoff is when we have to do many of these samples and need to have people out in the field. But I think there's a huge application for like emergency response. So if we can get these approved by our labs for use for, say, metals, and there's a fire where we want to assess blood metals, somebody else could use these, maybe not Biomonitoring California, but we have other environmental health investigations teams that do go in after emergency responses. And we ourselves have worked with firefighters to capture samples after a response. And this would just enable a much easier field presence. There was a lot of talk at ISES about them. I don't know if, Ian, you have anything to add to the use of microsamplers by other researchers. Sorry to put you on the spot, but.
Ian Tang, Biomonitoring California. Yes, there are a fair amount of researchers now using these microsamplers, or at least testing them. They've mostly been used to look at antibodies or proteins and things like that. So not really looking, excuse me, at chemical exposure. Some people that I've talked to, they've been successful. Others, they've said they've had issues, especially with populations such as young kids. It's supposed to be painless, but I've heard that they've been running into issues as well.
Thanks. Jenny, did you have a comment?
Hi, Jenny Quintana. I want to talk or ask you about your results return. The more I've been involved with this program, the more impressed I am with how pioneering California biomonitoring has been in returning complex chemicals to communities. And I think you're really leading the way here. And I'm curious how much evaluation do you do? Do you routinely do evaluation on your results returns? And are you thinking of publishing kind of like best practices from all your years of experience? Or maybe you haven't. I'm sorry if I missed that, but thank you.
We have done a number of results return evaluation rounds. I wouldn't say it's routine because there's always sort of a different angle on it. So for example, for CARE, we sent out a postcard with a results return packet, and we asked participants to be part of an interview afterwards and collected their information. We've done pre-results return evaluation, both with staff and community members, if there's a particular community we're trying to reach and want to make sure that our language are culturally and linguistically appropriate. For this round, Rebecca presented on last November. This is in the BiomSPHERE community. So again, a particular community that we want to be cognizant of the language we use and if our materials are appropriately accessible. So we are gathering a lot of information. There's been a lot of work done with UC Merced and CCAC, the California Asthma Coalition, working with those participants to get their feedback. And we're always trying to make them better. I mean, it's really complicated information to get into just the right language. One of the things we're really excited about is the electronic platform, which we're assessing both from a staff perspective. The results are very staff intensive to get the packets out the way they look, to make sure they're error-free, but also to make sure participants can access them. We've heard back from a lot of people that the thick packet of papers that you have to thumb through to find your results is actually kind of hard to get through, that people are not really used to getting so much data in that way. So an electronic platform where you can kind of dig down through links might be more accessible, but it's something we want to collect more data on. Silent Spring has done a lot of their own assessment, which we follow their example, and they do excellent work, but we want to try this out with the California population as well.
And then just to add, this is Stephanie Jarmal. We have actually already even started implementing some incremental changes to our materials, such as trying to reduce some of the amount of text, even though as scientists, I think we want to reiterate all the facts multiple times. We started introducing more graphics into our materials, and I guess we haven't really shown them to the panel yet. So that's something that maybe we can do at our next meeting, just to showcase some of the things that we've been working on across CDPH and at OEHHA.
We have published a couple of articles on results return generally, and actually through National Biomonitoring Network, we gave an extensive workshop on results return and evaluation.
Thank you.
We do have a comment from a participant. Dr. Samchai, if you wanted to unmute and ask your comment, your question.
Good morning. My name is Dr. Ahimsa Porter Samchai. I'm the principal investigator and founder of the Hunters Point Community Biomonitoring Program. I have a comment about the role of arsenic detections in human biomonitoring and the impact of geospatial mapping and detecting other chemicals in aggregate, how that impacts interpretation of the significance of an arsenic exposure, even if you don't know whether it is speciated to be inorganic versus organic. One of our early mappings I call the South Basin Cluster, and that's where we were detecting the same 4 chemicals in people living and working in an industrialized region adjacent to a system of federal Superfund sites in South San Francisco. The South Basin Cluster consisted of manganese and vanadium, which we were detecting early on, almost 100% of the time, and then arsenic and gadolinium. And we're not able to speciate the arsenic. We can send people we've tested to the San Francisco General Hospital, but it's a very, very lengthy and cumbersome process for them. But with our geospatial mapping, by just putting a pinhead with an assigned color, and for the arsenic, it was red, along with blue for gadolinium, yellow for manganese, and white for vanadium, in a map of this region called South Central Bayview, we were able to detect neighbors. We had 3 neighbors who had 4 of the chemicals or 3 of the chemicals. And unlike what you're doing, we only map detections that are above allowable levels, so that the significance is baked in when we're mapping these detections. We also had an unusual detection of 2 sisters in the same household who had all 4 chemicals detected above reference range, and the older sister, a registered nurse who'd been in the house longer, had higher concentrations of the same 4 chemicals. So I'm, just offering that in addition to speciating, arsenic when it's detected in high concentrations, looking at the pattern of its association, with other toxic chemicals. Vanadium is on the Proposition 65 list. And manganese, we have a detection frequency that has approached 100%, and shipyard soils have a detection frequency 100%, and shipyard air monitoring detects manganese in concentrations that exceed the World Health Organization's limits for safe human exposure. Thank you so much.
Thank you, Dr. Samchai.
Are there any other public comments in person or via the web?
We do not have any additional comments online.
Any other comments from the panel members? Whoops. All right, then I think we can wrap up this section just a little bit early and move on to the next agenda item. We will be hearing from Aalekhya Reddam next. She is research scientist in the Safer Alternatives Assessment and Biomonitoring section at OEHHA, and will give a presentation on preliminary findings from the BiomSPHERE study.
Thank you. Is this okay? Volume wise, perfect. Good morning, everyone. So today I will be presenting some of our preliminary work on our study titled The Biomonitoring Component of the San Joaquin Valley Pollution and Health Environmental Research Study, or BiomSPHERE. As many of you know, the San Joaquin Valley is heavily burdened by high levels of air pollution, and it contains 4 AB 617 communities, and those are the yellow dots that we see on the map. And these are communities that are selected by the California Air Resource Board, or CARB, as being disproportionately impacted by air pollution. I should also mention that there are many other communities that are impacted by air pollution in the Central Valley that have not yet been designated under AB 617. Several of our recent community biomonitoring studies have attempted to characterize exposure to air pollutants in this area. So these projects are the Stockton Air Pollution Exposure Project, or SAPEP, Fresca Mujeres, and BiomSPHERE, which is a study that I will be talking about today. Researchers from UC Merced and Berkeley received funding from CARB to initiate the San Joaquin Valley Pollution and Health Environmental Research Study, or SPHERE. And the goal of the study was to assess exposures to air pollutants and noise among families that live in Fresno and Stockton. BiomSPHERE added an additional biomonitoring component to this project, and its goals were similar. First, we really wanted to evaluate the air pollution exposures in families, but by analyzing urine samples for biomarkers of air pollution. And then we also wanted to examine differences in exposures between individuals, within individuals over time, and across the 2 different communities in Stockton and Fresno. And lastly, as I mentioned before, we had a few studies in the San Joaquin Valley, and BiomSPHERE is providing additional comparative data to those studies. For BiomSPHERE, we recruited 64 families, and these included a parent or grandparent-child pair. The participants either spoke English or Spanish, and a majority were non-smoking. We had 12 households in Stockton and 52 in Fresno, and the study activities mainly occurred between February to November of 2023. For the participant demographics, our adults were on average 42 years old, and the range was between 28 to 66 years old. And our children were on average 9 years old, with a range of 3 to 13 years old. Most of our adults were female, although our children were more evenly split. And while a majority being female adults is common when recruiting parent-child pairs, moving forward, we really hope to more intentionally recruit more adult males. For race ethnicity, our participants were mostly Hispanic Latino. For our household income, more than 50% of our participants had a household income of less than $30,000, and a majority of our participants rented their homes. As I mentioned before, the goal of our project was to assess exposure to air pollutants. 2 major classes of air pollutants are polycyclic aromatic hydrocarbons, or PAHs, and volatile organic compounds, or VOCs, and these are both known to be major components of indoor and outdoor air pollution. Exposure to these chemicals have known to cause cancer, as well as respiratory and cardiovascular health effects, among others. And here in the slide, we have a few potential sources of PAHs and VOCs. And as we can see, there are a lot of overlapping sources. Both PAHs and VOCs are formed when materials such as tobacco or fuels such as gasoline and oil are burned. And they're also known to be in consumer products such as paints, cleaning products, and air fresheners. PAHs can also be formed when food is grilled, barbecued, smoked, fried, or roasted. And some VOCs are also tied to gas appliance use. So today I will be talking about the air and biomonitoring results of our PAHs and VOCs in BiomSPHERE. In our study, air monitoring was conducted for 24 hours. We collected 1 indoor and 1 outdoor sample at each home. In the picture on the right, the arrows are pointing towards the different air monitors that we used to collect air concentrations for a range of air pollutants. We measured 36 PAHs. We also measure criteria air pollutants such as PM2.5, ozone, NO2, and carbon monoxide. And Kimberly Valle actually presented on these criteria air pollutants at our November 2024 SGP. We also measure black carbon, and we tried to measure VOCs. However, there were some issues with the oversaturation of sorbent tubes, and therefore we were only able to collect VOCs in a small subset of our population. So today I will be focusing on PAHs in this presentation, and we'll focus on the 4 that overlapped with urinary metabolites, or the metabolites that we can measure in urine. And these were naphthalene, fluorine, phenanthrene, and pyrene. For our biomonitoring samples, participants were asked to provide the first morning void the day after the air monitoring started. So this was designed to characterize exposure to air pollutants during the same time period that the air monitoring equipment was at the residence. For a subset of our population, which was 8 families, daily samples were collected over 4 consecutive days. And in the urine samples, we measured metabolites of PAHs, VOCs. We also measured biomarkers of oxidative stress and inflammation, and also cotinine, which is a metabolite of nicotine, to account for any potential smoke exposure or tobacco-related exposure. Now moving on to the data analysis that we did. For the air monitoring data analysis, if there were values that were below the limit of detection, or LOD, they were imputed by LOD divided by square root of 2. We also calculated the indoor and outdoor ratio for air samples when there was at least 1 indoor or outdoor sample that was detected in a household. And if a detected sample didn't have a corresponding pair, so for example, if we had an indoor sample that was detected and it didn't have a corresponding outdoor sample, we used imputed values. And then we used univariate linear models to examine associations between the PAHs in air and their respective metabolites in urine. For our biomonitoring data analysis, similarly, the values below LOD were imputed. We use creatinine adjusted values when comparing our concentrations to NHANES, just to keep it consistent with what NHANES does. But for our data analysis, we chose to use specific gravity adjusted values. And this is because specific gravity is a direct measure of dilution and is shown to be better, especially for children's samples. We also log transformed the values for normality. And then since 8 families gave multiple urine samples, in those families, we selected the one that was closest to the air monitoring, and then used linear models to, examine associations between the biomarkers of exposure and questionnaire data. So we will first talk about the PAH results. Before I talk about PAHs in air, I would specifically like to acknowledge Marley Zaleh from UC Berkeley for all her work on the air data analysis. It was an immense amount of work, so truly, thank you so much to Marley. As I mentioned before, we measure PAHs in both indoor and outdoor air at each home. And in this table, we have the sample size and detection frequencies for both indoor air on top and outdoor air below. And the ends represent the samples that had a valid detection. Pyrene, unfortunately, had fewer quantifiable samples compared to the other PAHs due to an instrument error. And that's why we have a lower sample size for pyrene. When looking at the detection frequencies of the PAHs in air, we see that naphthalene is the most frequently detected PAH, and this is consistent with what we see in other studies. And then when we calculated the indoor-outdoor ratio, here the ends represent the total number of matched pairs that were used to calculate this ratio. And we see something similar where naphthalene had the highest indoor to outdoor ratio, suggesting that the indoor concentrations are higher than the outdoor concentrations for naphthalene. For our pH metabolites in urine, we measured 9 pH metabolites for fluorine, naphthalene, phenanthrene, and pyrene. In this table, we have the detection frequency as well as the medians for adults and children separately. Only 2-hydroxynaphthalene, or 2-naphtol, as I'll be referring to it from now on, was detected in all the samples in both children and adults. But we also had high detection rates for 2-hydroxyfluorine, 1-hydroxyphenanthrene, and 1-hydroxypyrene. And for the most part, we see that children had lower or similar levels of PAHs to their adults. For our data analysis, we only selected metabolites with a detection frequency of 65% and above, which is similar to what the program has done, as Nerissa also mentioned. And those are the ones that we have highlighted here on this slide. We then compared the pH metabolites in BiomSPHERE to NHANES. So in each of these graphs, we have the geometric means and the 95% confidence intervals. The dark blue represents the BiomSPHERE concentrations and the light blue represents the NHANES concentrations. And we have a pair of graphs for adults and children, except for 3 and 4-hydroxyphenanthrene because there were low detection frequencies in adults. We compared our BiomSPHERE adults to the 20 years and older population in NHANES, and then compared our BiomSPHERE children to the children aged 6 to 11 years in NHANES, just because that was the closest age range to our BiomSPHERE children. And overall, in these graphs, we see that most of the geometric means of the PAHs for adults and children in BiomSPHERE are lower than those of NHANES, that is, other than 2-naphtol, where the concentrations are significantly higher in BiomSPHERE compared to NHANES in both adults and children. So we have much higher levels of 2-naphtol in our population. As you might remember, we had a similar finding in SAPEP, which was in 2021. So I put the values of NHANES, SAPEP, and BiomSPHERE in this graph to show the difference of the geometric means. In SAPEP, we only recruited children, and 1 and 2-naphtol were measured together. So we did the same comparison with children from NHANES and BiomSPHERE. And once again, in this graph, the light blue bar is NHANES, the dark blue bar are the BiomSPHERE concentrations, and the green bar is SAPEP. And really what we see is that SAPEP and BiomSPHERE are significantly higher than NHANES levels. SAPEP, while is higher than BiomSPHERE, it's not a significant difference, but both are significantly higher than what we see in NHANES. We then looked at correlations between pH metabolites in adults compared to children in BiomSPHERE. Each of these graphs show the correlations between the log transformed metabolites in children, which are on the x-axis, and adults on the y-axis. And R in each of these graphs are the Pearson correlation coefficients. And what we see is that out of all the pH metabolites, only 2 levels of 2-naphtol were strongly correlated between adults and children. And this, we think, is suggesting a common exposure source, and therefore we think that exposures are likely either happening at home or common activities rather than school or at work. We then examined the repeatability of pHs in urine, and we use intra-class correlation coefficients for these. As a reminder, we had families that gave urine samples for multiple consecutive days. We had 7 families that gave samples for 4 days, and 1 family that gave urine sample for 3 days, leading to a total sample size of 31 for the multiple samples. And in this table, the different colors represent the interpretation of the different inter-class correlation coefficients that are seen in the lower table. And the light green and the dark green represent good and excellent repeatability, respectively. So those are the ones that we'll really be focusing on. What we see is that 2-naphtol had excellent repeatability, and 2-hydroxyfluorine and 1-hydroxyphenanthrene had good repeatability in adults. And 2-naphtol was the only metabolite that had good repeatability in children. So this really suggests that there is relatively consistent exposure for fluorine and pyrene in our adult participants, and naphthalene in both our adult and child participants. We then looked at associations between pHs in indoor air and the respective metabolites. So since the detection frequencies were lower than 65% for all of our pHs in air, we looked to see if the concentration of the metabolites were significantly different between participants that had any detections in their indoor air or not. So in these graphs, we see the concentration of metabolites, and that's on the y-axis. And the white dots here represent households that didn't have any pHs detected in there, so they were not detected. But the green dots represent households that had pHs detected in air. And the black bars are the geometric means. And really what we see was that there were no significant differences between the pH metabolites in participants that had pHs detected in air or not. And we also didn't see any positive associations between pHs and metabolites and ones detected in outdoor air, suggesting that neither indoor nor outdoor air are a significant contributor to the metabolite levels. BiomSPHERE study also had two questionnaires. There was one that was before the air sampling data and one that was after the air sampling data. So the pre-sampling questionnaire was used for demographic and housing variables, and the post-sampling questionnaire asked questions about habit and product use over the past 2 days. We had a wide range of questions in both the questionnaires, and these are the ones that we focused on for our analysis. For the pre-sampling questionnaire, we asked questions about race, ethnicity, sex, household income, homeownership, the presence of an attached garage, and the city of residence. And for our post-sampling questionnaires, we selected questions on cleaning product, air freshener, gas stove, and personal care product use, as well as grilled food consumption. Among the pre-sampling questionnaire data, there were only significant associations with 2-naphthol. We assigned race ethnicity to the child based on the parents' race ethnicity. And as a reminder, we had a much higher proportion of Hispanic Latino participants. So due to the low sample size across the different multiple ethnicities, we binned race ethnicity into either Hispanic Latino or not Hispanic Latino. And if a participant was multiracial and selected Hispanic Latino as one of the races, they were also included into that Hispanic Latino category. We see that in both adults and children, geometric means were approximately 3 times higher in our Hispanic Latino participants compared to our non-Hispanic Latino participants. And then as a reminder, one of our aims was also to examine the differences between levels within Stockton and Fresno. And what we saw was after adjusting for race ethnicity, there were no significant differences in pH levels between Stockton and Fresno. But also as a reminder, we had a much smaller size in Stockton. We had an N of 12 versus in Fresno, we had an N of 52. As our Hispanic Latino participants had higher levels compared to our non-Hispanic Latino participants, we wanted to see if there was a similar trend in NHANES. So in these graphs, the adults are on the left and the children are on the right, and we see similar trends for both of the populations. And although we see that the levels are significantly higher in our Hispanic participants, compared to the non-Hispanic participants in NHANES, the magnitude is just so much higher in BiomSPHERE than it is in NHANES, suggesting that there are probably multiple factors that are contributing to the high levels of 2-naphthol in our population. Furthermore, although we have a small sample size of Black participants in BiomSPHERE, we also see that they have higher levels compared to our white participants. And this is similar to what we see in NHANES. But because our sample size is so small, we can't draw any concrete conclusions, but we really just wanted to highlight it and highlight the need for additional research to explore this finding further. We then ran associations with variables from our post-questionnaire data. So as we saw significant differences in race ethnicity, we adjusted for it in our models, and we saw significant positive associations with 2-naphthol and product use. So in this table here, we have the products that had significant associations and the percent of participants in BiomSPHERE that had used these products. And in both adults and children, we see significant positive associations with the use of household cleaners, air fresheners, and some personal care products and urinary 2-naphthol levels. In adults, we see that the use of plug-in air fresheners is associated with almost a 4 times higher increase of 2-naphthol. And then we also see 2 times higher concentrations of 2-naphthol in adults that use all-purpose spray, perfume, and any types of air fresheners. In children, we also see that plug-in air fresheners had the highest effect size on 2-naphthol levels, around 3 times higher. And then also approximately 2 times higher levels when children were in homes that used all-purpose spray, carpet or upholstery cleaner, any type of air freshener, or air fresheners or air freshener sprays. And then we also saw non-significant positive associations between other scented product use, such as scented lotion, scented body wash, deodorant spray, as well as restroom, furniture, glass, and floor cleaners, and urinary 2-naphthol levels in both adults and in children. And then we also wanted to examine if this product use was what was contributing to the high levels in our Hispanic Latino population. So when we ran models accounting for the reported product use in our associations between race, ethnicity, and 2-naphthol levels, the associations were only slightly attenuated. and the two naphthol levels were still around 3 times higher in our Hispanic Latino participants, suggesting that the product use cannot fully explain the really high levels that we're seeing in them. But yeah, moving on to our VOC results. We measured 6 VOC metabolites for acrolein, acrylonitrile, benzene, 1,3-butadiene, crotonaldehyde, and propylene oxide. And similar to PAHs, we only selected metabolites with a detection frequency above 65% for data analysis, which are the values that we've highlighted here. And these are the ones, again, that we use for data analysis. And in the VOCs with higher detection rates, we see that concentrations are higher in children, which is different than what we saw with the PAHs. But we did not see any VOC metabolites that were significantly higher in our BiomSPHERE participants compared to NHANES. We do see slightly higher levels of propylene oxide metabolites, which is consistent with what we saw in the East Bay diesel exposure project, and slightly higher levels of acrolein and acrylonitrile. However, none of these are statistically significant. And then when looking at the repeatability of VOCs in urine, we see that 4 of the VOC metabolites with a detection frequency of more than 65% had moderate to good repeatability in adults, suggesting a relatively consistent source of exposure for crotonaldehyde, acrolein, and acrylonitrile in adults, but not in children. And lastly, we did not observe any significant positive associations between the questionnaire data and the VOC metabolites. If you recall, in the East Bay diesel exposure project, we saw significant associations between gas appliance and candle use and BTEX metabolites, so metabolites of benzene, toluene, ethylbenzene, and xylene. And we use the CDC panel and EPTA because at that time, Biomonitoring California was not aware of any other labs in California that measure VOCs in urine. But the panel that we used in BiomSPHERE did not measure these BTEX metabolites, and then we think we might be missing those associations here. And then hence moving forward, we think it's important to use the same CDC panel that we use in EPTEP, and we think it may include more relevant metabolites, more relevant to our exposures of interest. And then luckily for us, EHL has actually recently developed these capabilities so we can run VOCs in-house for our next study. So with that, in conclusion, we did not see any significant associations between the detection of PAHs in air with their corresponding metabolites in urine, suggesting that it's not a significant contributor to the metabolite levels. We see that most levels of PAHs and VOCs in urine were either similar to or lower than NHANES, except for 2-naphthol. We see the correlations between adults and children and intraclass correlation coefficients, suggest that there is a common and consistent source of naphthalene. And we also see that 2-naphthol levels were significantly higher in our Hispanic Latino participants and were positively associated with household cleaning products, air fresheners, and perfumes. I also wanted to mention a couple of our next steps. First, we plan on having a community meeting in the fall to disseminate these findings from BiomSPHERE study to our participants and their community. And then we also plan on conducting some additional analysis, one to look at the associations between the biomarkers of exposure and the biomarkers of response. And lastly, we would also like to combine the data from the different studies in the San Joaquin Valley to identify potential sources of naphthalene in these communities, and also really dig into the data and try and identify optimal biomarkers of air pollution exposures and whether we should consider adding or dropping any of these for future studies. I would truly like to thank all our participants and project collaborators. As you can see, there's so many of them without which this study would not have been possible. And we'll take any questions. Thank you.
Thank you, Aalekhya, and congratulations on getting to this point in the project. It's always really exciting to see the results after all the hard work that went into this. So we'll start again with clarifying questions from the panel or the audience. Maybe I'll start with one. This is Lara. Could you repeat again the time frame for the air sampling and how it compared to the urine collection? Was it an integrated 24-hour sample taken around the same time as the urine?
It was around the same time. So I think air monitoring occurred in the morning, between morning and afternoon, and went for 24 hours. And the day it ended was the day we asked for the morning void sample.
Got it. Thank you. Yeah, go ahead.
Hi, Jenny Quintana, just a quick clarifying question, similar. So do you have any information on whether the participants were home that day or where they spent their time?
We do have information on that. I think most of the participants were at home that day.
And then the half-life of the metabolites is within that window, that same window is my understanding?
Yeah, I think so.
Yeah, this is Stephanie Jarmal. I can just add, they are pretty short for pHs and VOCs, I think about 6 to 8 hours. So we're hoping to capture their exposures while they were at home during that.
This is Amy Padula. I was wondering if the same instrument was used both indoor and outdoor, and which instrument that was. Or I can
The
also
same
look that
instruments
up.
were used indoor and outdoor. We did have a different instrument for naphthalene because naphthalene is primarily in the vapor phase. And let me see. We use for the pHs a 37 millimeter quartz fiber filter. And for naphthalene was an XAD containing sorbent tube.
This is clarifying, but it may actually lead to more depth later on. But when you looked at the measurements of air pollution, you were looking, PAHs was one of them. And even though naphthalene is volatile, if it's coming from cooking, you might see a peak. Did you look to see if there were peaks in the household of PM when there was also a really high level of naphthalene in the markers? And since the time course is fairly consistent, right? It wouldn't be like it takes days to see the naphthalene. Was there a way to look at a high event?
That is such a good point. We didn't have real-time monitoring for PAHs, so we weren't able to see any peaks. So it was just over the 24 hours, how much was collected. So, but I think that is a really good point. And moving forward, it would be interesting to incorporate that.
Yeah, I have a question. I think, so you said that there were no significant associations between the indoor PAH measurements and the urinary metabolites, but maybe I missed this, but did you also do a similar analysis for the outdoor concentrations?
We did.
And was it the same result?
Too. Yeah.
For the stenographer, that was Tom, and then Ulrika. Rebecca, are there any questions, clarifying questions online? No? Okay, so we can go ahead and move into more substantive discussion, questions and comments. We'll start with the panel. Go ahead, Tom.
I want to circle back to the naphthalene. I mean, we're looking at this data, and especially cultural differences. I really just have a suspicion that fried food is in there somehow. And I don't know how easy it is because when you fry something, you just get a burst of fine particles and PAHs, but they don't last very long. I don't know if it's might not be fully visible and only shows. So the thing about a biomarker is it's an integrator over a long time. And of course, some of it may be ingested related, but was there a way to really look into the way food was prepared in the households that had the high naphthalene in their blood urine?
We did have questions about if they barbecued or grilled food. So it was more about the food preparation, and I'm assuming it also is a food consumption, and there weren't any significant associations with that. And we also asked about, if they had cooked, and there weren't any significant associations with that either. So I wonder if there's like a specific method that we should really be focusing on more, asking more detailed questions, but the more general questions about barbecue, indoors, and cooking didn't yield anything.
I just want to follow up. The reason I bring this up is Lance Wallace, the name you may recognize, we're doing a lot of work on indoor air pollution. His wife was Hispanic, and they made a lot of tortillas on a frying pan. And of course, Lance Wallace measured everything. He has a house monitored for everything. And he said, when you take a tortilla and put it on the pan, he said, the monitors just went, through the roof and then dropped. And Wayne Ott and Lance Wallace are two people that did this all the time. So, you may be questioning people and they say, oh, well, we don't do anything unusual. Yeah. But that might not be unusual. They may not be frying food as they think, but an activity like that is actually something we don't think of, but it produces, from experimental evidence, produces a lot of both fine particles and PAHs.
So Martha, Sandy, I have a question for you, Tom, and thank you for giving that additional information. So I wanted to know if it was frying, by that you meant it was on oil or it's just a hot temperature? And I'm also wondering, has anyone looked at when you stir fry food, which is also very high temperature, would you also expect?
So I don't think Lance looked at that, but he looked at where you take a pan, you get it hot, put oil in, just a thin coat of oil, get it hot, and you throw a tortilla in until it's crispy and flip it over. I mean, that's what he looked at, that kind of I have a son who loves tortillas, and it's what he does all the time. And we have our purple air goes off the roof, and he does that.
This is Stephanie Jarmo. I just want to add quickly that to your point, Tom, we still did not see high levels of naphthalene in the air, though, which is why any of the activities that could be contributing to high air pollution levels, we actually didn't see particularly high air pollution levels. So perhaps it could be contributing to levels by consuming those foods, but I don't really know. We didn't see any associations with the air.
I see you, Oliver. We'll come to you next. There's more comments in the room. 1 second. Hold on.
Susan Hurley from Biomonitoring, California. As you know, I've been very interested in this whole naphthalene mystery. And one of the reasons I feel like it may not be related to cooking is that none of the other PAHs are particularly elevated, and particularly 1-hydroxypyrene, which it's my understanding is fairly affected by frying and cooking. So I haven't been able to find a lot in the literature about how these different PAH metabolites are related to cooking. And if anyone knows any good references on that, I'd love to see them. But that's why I'm kind of leaning towards away from thinking that the naphthalene levels are being driven by cooking.
And sorry, this is Stephanie. One more quick comment. I think Alekhya actually also looked at the correlation between the PAHs and did not see, or let's see what she saw.
Yeah, did not see any significant correlations between 2-naphthol and the other PAHs.
Which suggests that something really unique is happening with 2-naphthol there.
Is your question on naphthalene or related? Yeah. Okay. Let me, pass to Oliver, who's had his hand up.
Okay, now you can hear me. Thank you. I was wondering about the methods. I'm a little concerned about the high number of undetected compounds. And, over the years, methods have been improved. And, if concentrations were similar to NHANES, I think we should expect now with today's methods better detectability of these compounds. Can you comment on those? And, whether or not improvements in methods have been considered?
Sorry, Oliver, are you talking about detections in urine or detections in air?
In urine.
I'm not sure I have an answer to that. I don't know if there's anyone else who would better
Well, and can you show your slide? I think we had pretty high detections though, for a lot of the chemicals, only some of the metabolites. We did not see detection frequency over 65%. Do you have another comment, Oliver, or it looks like Jean Wen
No,
also
no,
wants
that's
to say
fine.
something.
Thank you.
Okay, thanks. Jean Wen, did you want to comment? I think you need to unmute. There you go.
Yes, Dr. Aalekhya, and I think that's a very good question. When we talk about detection frequencies, we always need to link with the method detection limits. We did a lot to do this study. UCSF provided the test to support the study, but you're absolutely right. With today's technology for pH metabolites, according to our own experience, within the organic group, we have the most sensitive method, which required high resolution GCMS. So I don't know what's the method detection limits the other laboratories using, but definitely that's associated with detection limits.
Thank you, Jean Wen.
Thanks. This is Amy Padula. I guess I have a question. I'm also wondering if traffic-related pollution still may be impacting the urinary ones in a location maybe outside of the home. So I guess I'm still curious. I know you said maybe most of the people were home. Was this done on the weekend then? Like, so the children were not at school, presumably?
I don't know the numbers off the top of my head.
Okay.
I think some of the children were at school, but I think, yeah, for the majority of the time was spent indoors.
Even at school?
Even at school, yeah.
Right, okay. But I guess I'm just still a little bit, wondering about that because, it's hard to make sense of these things otherwise. And then, and also wondering if you've looked at other traffic measures maybe in the neighborhood beyond just the measurement of that single day. I mean, if there's any other maybe differentiation we could see by where people lived and potential traffic exposure outside of this.
I know we have a variable, we haven't looked at associations with it, but distance to Highway 88. And I think that would be interesting to look at. But then I think it comes back to the same thing that if that's a contributor, then maybe would we see higher levels in the air? And would it also potentially be associated with the metabolite levels? So that's also, or maybe there's another exposure source that we're missing. Is it in the soil and food? Yeah.
And I just feel this is so common with PAHs, this like disconnect between the urine and the air. I'm not sure where we're going wrong.
And Asa Broadman's online. You're unmuted, Asa. Did you want to say something?
Yeah, I just typed a little note in, but when the urine samples were collected in the morning, so they probably mostly reflect home exposure. And then we do have traffic information. We have traffic near the home based on the traffic tool from California Tracking. And then we also separately plotted the distance to the 99. Which is a major truck route. And we see, for example, some correlations with black carbon measurements and the 99. So traffic is something that we could look at. I don't have enough experience with PHs to know whether naphthalene would be different than some of these other compounds we measured and why it seems to stand out in this population.
Jenny, go ahead.
Hi, Jenny Quintana. Just a couple things. If you have an indoor source and you have a population like this where you have a great variation in income levels, something that can mediate that is home volume. And I'm just curious if you have collected home volume or how many bedrooms or square feet at least is one thing that could affect same source, be higher level in a smaller home. We see that for indoor smoking, for example. And I was also curious, I think you did say you collected information on home ventilation and behaviors like opening doors and windows. So that would be of interest. So one particular, sorry, is that someone on
Just
mine?
to answer that question too.
Yeah.
We do have an estimate of the volume of the dwelling. And we also, and square foot, and we also have an estimate of the air change rates. So we do have some of that information.
And I guess my last couple comments would be just that I think of naphthalene as one source in Central Valley, and as is in Imperial Valley near San Diego, is agricultural burning. And I'm just curious if you have burns in locations. And also just to say, this is a fairly small sample size, especially if you have detection levels, and you can't see correlations if you don't have variability. So if you have little variability in the participants, there could be a real source or something, but you just won't see a correlation with a small sample size. That's all. Thank you.
Thank you.
This is Kris. Thayer. I had a question. So the temporal variability, the interclass correlations, coefficients, they seem like they were generally lower for kids compared to adults. Is that sort of a pattern that you've seen in other temporal
I think
variations?
so. Yeah, I think children also just have higher variability, like their metabolism is more variable too. And Meltem, if you have any thoughts, but I think this is consistent with what we've seen in literature too, where children just tend to have more variability than adults do. The habits are different.
Maybe I'll take this low to check in with Rebecca, see if there's any comments. No, okay. Yes.
This is a more sweeping question, but especially thinking about pHs and some of these VOCs and their comparisons within NHANES. I don't want to sound like a broken record, but I've also worked in tobacco control. And if you go any other state besides California, you really notice how secondhand smoke, work on thirdhand smoke, there's so much more contamination. And I'm almost wondering if we should really compare, say, the children to those NHANES participants with the same levels of urinary cotinine, which are usually very low in California compared to other states. And that way it might be a more fair comparison for the other exposures to pHs or something like that. I know that information is available, but you have to jump through hoops to get it. Maybe, yeah. Thank you.
Oh, that's a great point. Thank you.
This is Stephanie Jarmel too. Just wanted to add a point that some new research has come out about some trends that they're seeing in 2-naphtha levels, and we are seeing in general an increase globally, it seems, but not again to the extent that we're seeing in our population in the Central Valley. So we have had some more recent data to compare to other than just NHANES. Our values still seem very high in the Central Valley.
This is Lara. I know you mentioned you're having a community meeting coming up here soon. So I don't know how many you've had so far, but I'm just curious if participants or community members, if they've seen this, how they've reacted to it, and if they have any thoughts on exposure sources.
This is Stephanie again. You know, surprisingly, we have not gotten many comments of concern about the naphthalene levels, and we do try to message it as such that, you know, we're not sure of the sources, but here are still some ways that you can reduce your exposures to naphthalene and other pHs. So we try and also give them some opportunities to perhaps reduce their levels if possible. But in general, we haven't received any particular concern from community members. And we haven't shared these results for BiomSPHERE, but we did just have our Fresca. This is a little teaser. We are seeing the same trend in our Fresca population. So for SAPEP, BiomSPHERE, and Fresca. And so we did not have any comments from our Fresca participants on it.
So I do kind of have another follow-up question about the two-naphthol. One of them is it's associated with use of certain kinds of products like the air fresheners and things like that in particular. But do you have any kind of temporal data about when they were using that relative to when they did the sample collection?
We only have data about if they used it today or yesterday. And I think we were thinking about diving in a little deeper to see if it was closer, are the levels higher in any way? So yeah, that is a good point, but that's as high temporal resolution that we have.
And sorry, stepping in just to add to that, we did also reach out to CARB as part of their consumer products survey to see if it's possible that naphthalene could be an ingredient in some of these fragrances and not be listed. And it is possible that it could be under fragrance, but we don't know if it is in fact in these products.
I'm just curious, because we're doing so much comparison with the NHANES subset that's analyzed for environmental chemicals, if that effort is ongoing at the same pace currently as we're used to, are we going to still continue to get this same data? Do you have anybody have any information?
In terms of like the date for NHANES, we're still comparing it to 2015 to 2016. Is that
right? I'm just
Yeah.
wondering if efforts are currently affected by current events at the CDC, since some other things have been affected.
Kathleen, did you get an update on that at ISES?
Yeah, I don't think I can speak for the CDC and NHANES program really well, but did hear, yeah, that the plans are ongoing for the next cycle and that the lab's work has been sustained. It seems like the ability to chug through all the data to get it posted is further delayed than it has been. So we shouldn't expect, newer rounds of data to appear super quickly. Thank you. Yeah, Tom, go ahead.
Yeah, what round of the NHANES was this compared to?
The PEHs were 2015, 2016. So it was,
Oh,
yeah.
okay.
And the VOCs were 2017, 2018.
And this was what year? Sorry.
BiomSPHERE is 2023.
Right. So there's a lot of years in between.
Yeah, there are a lot of
So
years.
somebody has introduced a new product on the market.
Yeah.
That would be in every household in the country, but we wouldn't have seen it back in the last, okay.
Yep.
I mean, that's one thought, is that there's something that people are using that we found.
Yeah.
I mean, that you saw in California, but it's not in NHANES because the product just came into the market more recently. I mean, it's just speculation, but it could be something.
And we've tried to see if there's literature out there with more recent studies that have 2 naphthol levels, and all of it is outside the US. But again, like Stephanie said, they are also increasing, but there just isn't any literature on urinary 2 naphthol here in the US that we can compare to.
And we do have Jean Wen who would like to provide a comment online.
Yes, thank you. I think the team is very interested in the source of the naphthalene and also broad group of pH. So the pH might have the dietary input and also there. So for example, of course, we find very high levels of 2 lab and which stand out. For laboratory, which raise the question is beyond the question layer, is the laboratory have new markers visited? I think that they might be, because when naphthalene go to our bodies, which form 1,2 epoxide. 1,2 epoxide forms 1,2 dihydroxylaphthalene. Instead of monitor one monohydroxylaphthalene, dihydroxylaphthalene could be a good marker. And then, so the laboratories explore that path because the dihydroxylaphthalene might better correlated with inhalation instead of the dietary exposure of the pH, especially for the naphthalene exposure. Second comment, as the presentation show, MTBEX tend to have a better correlation between the urine and air. But MTBEX is always single benzene rings, and then naphthalene have 2 benzene rings, which is also qualify naphthalene as a VOC. So MTBEX volatile metabolites as a VOC. So what my point is, naphthalene could be have a VOC metabolites, which is a mercapturic acid when it's combined with glutathione. So laboratory also looking for the way to find the VOC metabolites as a new biomarker and on to characterize naphthalene's overall total exposure, because mono or di plus VOC may give us a full picture. So that's just one comment how we try to solve from an analytical technique part of the issue.
Okay, any more comments or questions online or in the room? Amy.
I have one other thing, and I was just wondering, I noticed this was done across several different months, and I was just wondering if there's any difference by season.
Oh, that is a good point. I think we did see differences by season. Dan, do you? Yes, we did. I don't have the results off the top of my head.
Okay, if there are no further comments or questions, we can wrap up this section. Thank you so much, Alekhya, for really provocative thought and provoking presentation, and to Nerissa for the great overview of all the great work happening at Biomonitoring California. So we will have, I guess, a little bit longer lunch than expected. We will reconvene at 1:05, so please be here before that so we can start promptly after lunch. Thanks.